Okay, today me and my partner Ahmad will be presenting on the case study number 3. So, what we have here is a 45-year-old lady was admitted due to severe acute exacerbation of bronchial asthma. Her initial blood gas analysis is shown as below. Question A. Is there an acid-base disorder present in the initial blood gas? If so, what type? 2 marks. Yes, there is an acid-base disorder present in the initial blood gas results, and it is found out to be a mixed acid-base disorder. This is because the result for pH, which is 7.35, falls in the normal range, but the partial pressure of carbon dioxide is 4 kilopascal, falls below the normal range. In addition, the concentration of bicarbonate ion, which is 18 millimolar per liter, falls below the normal range as well. A mixed acid-base disorder is indicated by a normal pH with an abnormal partial pressure of carbon dioxide or bicarbonate ion, and the above result matches this description.
What is the possible explanation for the initial blood gas? The keywords are severe acute exacerbation of bronchial asthma, based on the initial reading of pH, partial pressure of carbon dioxide, partial pressure of oxygen, and concentration of bicarbonate ion. The pH appear to be normal. The partial carbon dioxide is low. The concentration of bicarbonate ion is low. The partial pressure of oxygen is low. The pH level appears normal as the body experiences both respiratory alkalosis and metabolic acidosis. It is a way to try to compensate at the same time, whereby the metabolic acidosis causes the decrease in pH, while respiratory alkalosis causes an increase in pH. Thus, the pH appears to maintain within the normal range, and this results in mixed acid-base disorder. In case of the patient, she experienced severe acute bronchial asthma attack, which causes her to hyperventilate quickly. Hyperventilation causes carbon dioxide to respire out of the body at an abnormal rate. This causes the patient to experience respiratory alkalosis, in which the alkalinity within the body is increased due to the high amount of carbon dioxide, which is acidic, to be exhaled out of the body. Next, the body tries to compensate this by reducing the bicarbonate ion within the body, which triggers the compensatory mechanism for respiratory alkalosis. The partial pressure of O2 is greatly reduced because the patient is experiencing hyperventilation, in which oxygen and carbon dioxide is rapidly inhaled and exhaled from the body during an asthma attack. Hyperventilation actually increases the oxygen within the lung, but the body cannot use this oxygen because your body requires a certain amount of carbon dioxide to facilitate normal respiration.
Question C. Comment on her second blood gas results. What led to this blood result? 4 marks. Firstly, pH of the patient's blood is 7.2, which is low, as it falls below the normal range. Low blood pH is caused by the elevation in partial pressure of carbon dioxide. Carbon dioxide is acidic in properties. Therefore, when the partial pressure of carbon dioxide is high, it causes the blood to be acidic as well. Therefore, when the pH of the blood is measured, pH level drops, indicating the presence of an acidic environment. Secondly, partial pressure of carbon dioxide is 7.5 kilopascal, which is high as it falls above the normal range of 4.7 to 6 kilopascal. High partial pressure of carbon dioxide is indirectly caused by the disease, acute exacerbation of bronchial asthma. When the patient is experiencing this disease, her airways are swollen and inflamed. This causes slower rate of airflow into the lungs. Patient will then hyperventilate in order to increase the intake of air into the lungs. Unfortunately, hyperventilation will cause the opposite effect by causing smooth muscles surrounding the airways to contract, causing the bronchioles to further narrow. Hyperventilation results in low partial pressure of carbon dioxide, and this would encourage the airways to constrict, as carbon dioxide is a natural bronchial dilator, as it functions to relax the muscles, where it allows the dilation of airways. When this happens, the patient would have trouble in breathing, which includes shortness of breath. The body detects the low partial pressure of carbon dioxide in blood. Therefore, the body reacts to this change by progressively adjust the breathing pattern to hypoventilation in order to compensate the loss of partial pressure of carbon dioxide. Unfortunately, prolonged hypoventilation would then lead to excessive carbon dioxide being retained in the body. This occurs as the effective alveolar ventilation fails to keep pace with the rate of carbon dioxide production, causing the high partial pressure of carbon dioxide in the blood. Elevation of carbon dioxide causes the body to compensate the increasingly acidic environment, a fall in pH, by increasing the concentration of bicarbonate ion, which is basic in property.
Thirdly, partial pressure of oxygen is 5.1 kilopascal, which is low as it falls below the normal range of 12 to 14.6 kilopascal. Low partial pressure of oxygen is caused by the disease as well. When the patient experiences hypoventilation, which leads to slower rate of breathing, the rate of air flowing into the lungs decreases, causing the partial pressure of oxygen in the blood to decrease as little air gets into the lung for gaseous exchange to occur. Fourth, concentration of bicarbonate ions is 16 molar mole per liter, which is low as it falls below the normal range of 34 to 29 molar mole per liter. Low concentration of bicarbonate ion is caused by the disorder the patient is experiencing, which is respiratory acidosis. Respiratory acidosis happens when there is an increase in the partial pressure of carbon dioxide. Primary disturbance by elevated level of carbon dioxide leads to a secondary response where the concentration of bicarbonate ions as well as the compensatory change in order to buffer the increased acidity caused by the elevated level of carbon dioxide. Bicarbonate ions are basic in property as they are capable of accepting a hydrogen ion, thus resisting the changes in the concentration of hydrogen ion when external disturbance is introduced, such as addition of acid.